For Kenyan to know, prepare well. Next week on Monday at night, we are going to close down those public facilities because the employer is still playing the games of hide and seek, that they only express the goodwill, demonstrate some goodwill when we are on strike. When we walk out, they renegade on the same and they walk away. Therefore, we will pick it from where we left it because we will not get tired. They are the one who have been given responsibility by the Kenyan to actually spend our money to guarantee services, whether health or security, it is issues of common. And when the chair mentioned of the cartel, the first cartel in the health sector currently, whose advice do not really demonstrate demonstrate an ability to offer services, is the Director General. And we must say, unfortunately, he is the highest officer technically in terms of medical services who advise the president and everyone. Even currently, he sits in the Presidential Task Force on issues of health. So we doubt the outcome of that task force because of interest and by being taken or rather being taken captive by the same person who we castigate and we feel that has no goodwill to guarantee medical services. And therefore, we must say that we as clinical officers, our interest is for that, or is those of the patient, so that patient can get services. Anytime patient cannot get services and we are in the facility, we have to call upon those who have the responsibility to do so, because the law is not a problem. The problem are people who have self-interest actually to enrich themselves using our own money. And sometimes when I say this, people may fail to understand, because all the money we are contributing, now more than 3 times what we used to contribute, is only a reserve to be used in level 4, 5, and 6. And how many facilities are those? Are less than 47 facilities. At some of the, no, not 47, 400 out of over 15,000 facilities in the country. So we are talking about over 300 billion estimate of collection to be used in 400 facilities, where all the other over 14,000 will depend on 2,000. That's 300 billion for 400, and we only have 2.7 billion for all the other 14,000 facilities.
Across the country, we had a national strike, which we suspended for 21 days. Those 21 days will end on Monday next week, and we have not been able to conclude a collective bargaining agreement and the other items in the return to work agreement of 2024 that was registered in court. So it seems that everything is directing us to go back on strike from Monday. So I want to inform clinical officers wherever they are in this country that they should prepare themselves to go back on strike on Monday, because the county governments seem to be unwilling to implement a joint agreement. And we are not talking about demands from the union. We are talking about implementation of an agreement between ourselves and the 47 county governments, an agreement which we jointly, as the union and the county governments, deposited in court in good faith. But they have refused to do that. The third thing is that we are still locked out of the Social Health Authority. We cannot be able to pre-authorize. And I must say this, and I want to be very clear. As we have said before, the cartels that destroyed the NHIF are alive and well. I remember the president at one time saying that as long as he lives, he will not accept to have cartels under Social Health Authority. And with clarity, I want to inform the president today that the cartels that were under the National Health Insurance Fund, they are alive and well under the NHIF, comprising of some officers from the Ministry of Health at very high positions, some officers in the Kenya Medical Practitioners and Dentist Council, and Social Health Authority. And if he wants, he can call us, we will give him details. This cartel, they operate by trying to monopolize the access to the health services. Even this limitation of clinical officers, knowing very well that they are the ones who see patients, fits to their strategy and objective that is ill-intentioned to ensure that they monopolize. They become the gatekeepers to the accessibility of health services.